Chickenpox, also known as varicella, is a highly contagious viral infection. It is caused by the varicella zoster virus, or VZV. This common childhood illness is characterized by itchy blisters that appear all over the body. While generally mild, chickenpox can be more severe in infants, adults, and those with weakened immune systems. The virus spreads easily through the air by coughing or sneezing, and also by touching or breathing in the virus particles from chickenpox blisters. The incubation period, which is the time from exposure to the virus to the onset of symptoms, is typically 10 to 21 days. The hallmark symptom of chickenpox is, of course, the itchy rash, which usually appears first on the chest, back, and face before spreading to the rest of the body. These itchy spots develop into small, fluid-filled blisters, which eventually scab over. Chickenpox can also cause fever, fatigue, loss of appetite, and headache. These symptoms usually appear a few days before the rash develops. While the rash itself can be quite uncomfortable, most people with chickenpox recover fully within a week or two. Recognizing the early signs of chickenpox is crucial for timely intervention and management. The first clue is often a general feeling of being unwell, accompanied by fatigue and a mild fever. This initial phase can easily be mistaken for a common cold or flu, but the telltale sign that sets chickenpox apart is the characteristic rash. The rash typically emerges as small, red bumps, initially appearing on the torso. These bumps quickly transform into itchy blisters filled with fluid. The blisters tend to break open, forming scabs. It's important to note that new waves of the rash can continue to appear for several days. Beyond the rash, other symptoms might surface, including headache, loss of appetite, and body aches. For most healthy individuals, chickenpox runs its course without severe complications. However, infants, pregnant women, and individuals with compromised immune systems are at a higher risk of developing serious complications. If you suspect chickenpox, it's essential to seek medical advice promptly. Early diagnosis not only facilitates effective management of symptoms, but also helps prevent the spread of the virus to others. When it comes to chickenpox, the primary focus of treatment is to alleviate the discomfort associated with the itchy rash and manage the accompanying symptoms. While the virus itself doesn't have a specific cure, several approaches can help ease the course of the illness and promote faster recovery. Traditional remedies, passed down through generations, offer a natural approach to soothing chickenpox symptoms. These often involve using ingredients readily available at home to provide relief from itching and promote healing. Calamine lotion, with its cooling properties, has long been a go-to for calming itchy skin. Modern medicine provides additional tools to manage chickenpox. Over-the-counter pain relievers, like acetaminophen or ibuprofen, can help reduce fever and alleviate discomfort. Antihistamines, available in both oral and topical forms, can be effective in reducing itching. In certain cases, your healthcare provider might prescribe antiviral medications, particularly for individuals at higher risk of complications. These medications work by slowing down the replication of the virus, thus reducing the severity and duration of the illness. For centuries, long before modern medicine, people have relied on traditional remedies to find relief from the discomfort of chickenpox. These time-tested practices often utilize natural ingredients found in most kitchens, providing a soothing touch to ease the itchy rash and promote healing. One such remedy is the application of oatmeal baths. Oatmeal's anti-inflammatory and soothing properties can work wonders in calming irritated skin. Adding a cup or two of finely ground oatmeal to a lukewarm bath and soaking for 15 to 20 minutes can provide significant relief from itching. Another age-old remedy is the use of baking soda. Known for its antiseptic and drying properties, baking soda can help soothe the itchy blisters and promote faster healing. Adding a cup of baking soda to a lukewarm bath or making a paste with water and applying it directly to the affected areas can be quite effective. These traditional remedies, passed down through generations, offer a gentle and natural approach to managing chickenpox symptoms. While they might not cure the virus itself, they provide much-needed relief from the discomfort and promote a sense of well-being during the recovery process. While traditional remedies offer a natural approach to soothing chickenpox symptoms, modern medicine provides additional tools to manage the illness and prevent complications. Over-the-counter medications readily available at your local pharmacy can help reduce fever and alleviate discomfort. Acetaminophen or Tylenol and ibuprofen or Advil, both effective pain relievers, can help bring down fever and reduce body aches associated with chickenpox. It's crucial to follow the recommended dosage instructions and consult your doctor before administering any medication to children. Antihistamines, available in both oral and topical forms, can be highly effective in reducing itching, a hallmark symptom of chickenpox. Oral antihistamines, such as diphenhydramine or Benadryl and cetirizine or Zyrtec, work by blocking histamine, a substance released by the body during an allergic reaction that causes itching. Topical antihistamine creams or lotions applied directly to the itchy areas can provide localized relief. Calamine lotion, a popular choice, contains zinc oxide, which has soothing and drying properties. It's crucial to avoid scratching the blisters, as it can lead to secondary infections and scarring. Home remedies, often passed down through generations, offer a natural approach to managing various ailments, including chickenpox. While some remedies hold merit, others might be based on anecdotal evidence rather than scientific backing. It's essential to approach home remedies with a discerning eye, separating fact from fiction. One common home remedy for chickenpox is applying cool compresses to the affected areas. This practice can indeed provide relief from itching by soothing the irritated skin. However, it's crucial to use a clean washcloth for each application to prevent the spread of infection. Another popular remedy suggests avoiding scratching the blisters at all costs. This advice holds significant weight, as scratching can lead to secondary bacterial infections, scarring, and prolonged healing time. Keeping fingernails short and clean can help minimize the risk of scratching, especially in young children. While some home remedies advocate for specific dietary changes during chickenpox, it's essential to consult your healthcare provider for personalized advice. Maintaining adequate hydration is crucial, but restricting certain foods might not be necessary unless recommended by a medical professional. Prevention is always better than cure, and this holds true for chickenpox as well. While the virus is highly contagious, several measures can significantly reduce the risk of contracting and spreading this childhood illness. Vaccination, coupled with good hygiene practices, forms the cornerstone of chickenpox prevention. The chickenpox vaccine, scientifically proven to be safe and effective, is the most potent weapon in our arsenal against this highly contagious virus. The vaccine, typically administered in 2 doses, provides long-lasting immunity to most individuals. Good hygiene practices play a crucial role in preventing the spread of chickenpox. Since the virus is primarily spread through respiratory droplets released when an infected person coughs or sneezes, covering your mouth and nose with a tissue or your elbow when coughing or sneezing can significantly reduce the risk of transmission. Frequent hand washing with soap and water for at least 20 seconds, especially after coughing, sneezing, or touching your face, is paramount in preventing the spread of germs. If soap and water are not readily available, using an alcohol-based hand sanitizer can be an effective alternative. The chickenpox vaccine, a testament to modern medicine's advancements, stands as the most effective shield against this highly contagious and potentially troublesome virus. This vaccine, containing a weakened form of the varicella-zoster virus, triggers the body's immune system to produce antibodies without causing the actual illness. The chickenpox vaccine is typically administered in 2 doses, the first dose between 12 and 15 months of age, followed by a booster dose between 4 and 6 years of age. This 2-dose regimen provides long-lasting immunity to most individuals, protecting them from the discomfort and potential complications of chickenpox. The chickenpox vaccine is remarkably safe, with most individuals experiencing only mild side effects, if any. These side effects, usually limited to pain, redness, or swelling at the injection site, are temporary and far outweigh the potential risks associated with contracting chickenpox. Vaccination not only protects the vaccinated individual, but also contributes to herd immunity, a concept where a high percentage of vaccinated individuals indirectly protect those who are not vaccinated, such as infants too young to be vaccinated or individuals with certain medical conditions. Maintaining good hygiene is not just a matter of personal cleanliness, but a vital step in preventing the spread of various infectious diseases, including chickenpox. Simple yet effective hygiene practices, ingrained in our daily routines, can significantly reduce the risk of contracting and transmitting this highly contagious virus. Hand washing, often dubbed as the first line of defense against infections, plays a pivotal role in breaking the chain of transmission. Washing hands thoroughly with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public places, effectively removes germs and prevents their spread. Covering your mouth and nose when coughing or sneezing is another crucial hygiene habit. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air, potentially infecting others. Using a tissue or your elbow to cover your mouth and nose can effectively trap these droplets, minimizing the risk of transmission. Avoiding close contact with infected individuals is paramount in preventing chickenpox. Since the virus is highly contagious, it's best to maintain a safe distance from those exhibiting symptoms. Children with chickenpox should be kept home from school or daycare until the blisters have crusted over to prevent further spread. Chickenpox, despite being a common childhood illness, is often surrounded by myths and misconceptions. These myths, passed down through generations or fueled by misinformation, can lead to unnecessary anxiety and influence decision-making regarding prevention and treatment. Let's debunk some of these common chickenpox myths and separate fact from fiction. Myth: you can only get chickenpox once. Fact: while it's true that most people who contract chickenpox develop lifelong immunity, the virus can reactivate later in life, causing shingles, a painful rash. The varicella-zoster virus, responsible for chickenpox, remains dormant in the body and can reactivate due to stress, aging, or a weakened immune system. Myth: chickenpox is just a harmless childhood illness. Fact: while chickenpox is generally mild in healthy children, it can lead to complications, especially in infants, adults, and individuals with weakened immune systems. These complications can range from bacterial skin infections to pneumonia, encephalitis, inflammation of the brain, and even death in rare cases. Myth: catching chickenpox naturally is better than getting vaccinated. Fact: this is a dangerous misconception. Vaccination provides a controlled and safe way to develop immunity to chickenpox without the risk of experiencing the actual illness and its potential complications. The chickenpox vaccine is highly effective and safe with minimal side effects.